Hello everybody and welcome back to my YouTube channel. So today we are going to discuss the tips and tricks along with the preparation strategy to crack and qualify for ICT MTech. So ICT in Mumbai, Matunga is one of the brand you can say in pharmacy category. So MTech, Masters in Pharmaceutical Technology, you have Masters in Perfumery and many other allied subjects. So for that, there is a separate entrance exam and it is usually conducted before August only. So it's better that you refer the website in around May. So I have my ICT MTech score 39 out of 50, which is the highest, and I'm All India rank 1 in ICT MTech for my ICT MTech score exam. So speaking about the industrial aspects, that what are the most probable questions that can appear. So this is a syllabus that you will find on the ICT MTech website for their examinations. So they usually refer Martin and Remington. These are the two important books that you need to refer if you're preparing for ICT MTech. So if it comes, so you need to know about the industrial aspects like the pharmacopoeias, the addition, the different routes of administration, then a brief about posology and just small concepts of anatomy. So anatomy usually Ross and Wilson is preferred. So for anatomy, the different systems, cardiac cycle, blood products, blood components, all those things. Now if we speak about physiopharmacology, so hematinics, that is iron and ferrous sulfate, ferrous gluconate, all those thrombolytics, which are also known as fibrinolytics, like streptokinase, plasmokinases, coagulants and anticoagulants like vitamin K, protamine, warfarin, heparin, hirudin, digestive antacids like we have aluminium carbonate, sodium bicarbonate, we have local antacids as well as systemic antacids. Purgatives, these are used to evacuate the stools. So you have strong purgative action like of senna, which is a naturally obtained drug. Then you have kidneys. So for kidneys, you have diuretics that are used to increase the urine flow, and you have antidiuretics that are used to restrict the urine flow. Then general pharmacology, like the types of receptors. Then you need to know the mechanism of action, the mode of administrations, like oral, parenteral, vaginal, rectal, urethral. There are multiple modes of administration. So you need to know the routes of administration. And then bioassay. Bioassay of histaminics and antihistaminics and certain concepts of local anesthetics. Speaking about physiopharmacology too, so here you have drugs of CNS. So here you have Parkinson, Alzheimer's, depression, psychotics, mania, schizophrenia, bipolar diseases. These are few of the categories in which you have chances that the question can appear. The probability is quite high because CNS drugs are very important, because even while designing and pre-formulation studies of CNS drug is very difficult. So you can expect a question or two from the same category. If you speak about the next topic, oral hypoglycemic, that is anti-diabetics. You have chemotherapy, that is anti-cancer. You have antibiotics, drugs acting on uterus. So you have whenever there's a pregnancy. So there are uterine contractants which are used to enhance so that the labor contractions are more. And there are uterine relaxants that are used to reduce the contractions. So you need to know the drugs. Next, we have drugs on cardiovascular system. So you have angina, drugs acting in angina pectoris, arrhythmia, hypertension, myocardial infarction, congestive heart failure. There are certain drugs that act. So you need to know the drugs, the classification. Immunopharmacology. So there are immunosuppressants. So while you're doing an organ transplant, there is a new organ that is incorporated into your body. So our body has immune system. So immune cells quickly try to reject that organ. So to avoid that rejection of organ by our body, we give an immunosuppressants so that our body can easily accept the new organ and the transplant can be successful. Similarly, immunostimulants are those agents that are used to boost our immune system, like Chyawanprash. So Chyawanprash is ashwagandha. Ashwagandha is an immunomodulator. Ginseng, which is an immunomodulator. So you need to know about them. Next, medicinal chemistry. So medicinal chemistry questions are very tricky, and if you do not have your base clear, then it is a big, like it's a question for you to even qualify for ICT, because medicinal chemistry plays a very vital role. So NSETs, Then you have anti-infectives, you have antibacterials, anti-amoebic, anti-malarial, anti-helminthics. These are few of the categories that have to appear in the exam. Now, if we speak about the next topic, which is synthesis. So for synthesis, we have pharmaceutical chemistry. Here we have drug designing. So there are various methods of drug designing: de novo drug designing, homology drug designing. So you need to know that. Retrosynthesis, they focus on retrosynthesis a lot. So see to it that you refer the retrosynthesis notes. And next up we have heterocycles and fused ring. So they do not expect you to remember the entire structure of a drug, and to be honest, it's not possible to remember so many structures of so many drugs. But the only thing you need to remember is the basic nucleus in that drug. So suppose if it's ciprofloxacin, if it's doxycycline, so we need to know that if it's a fluoroquinolone, if it's a tetracycline, what will be the ring? So it will be a quinoline ring, it will be a octahydronaphthacene ring. So that is what is important and is expected to be remembered. Next up we have is microbiology. So in microbiology we have staining, we have microscopy, we have culture methods, then we have immunology, then we have vaccines, and then finally we have sterilization. There has to be a question for sure. This year also when I appeared for ICT, there were questions on D value, there was question on culture media. So you have to expect a question upon the same. Next up we have is formulation technology of liquid orals. So liquid and orals basically include your suspension and emulsions, which are your biphasic dosage form. Topicals. So topical you have ointment, cream, paste, jellies. These are all semi-solid dosage form. And unit operations. So whenever we are preparing something, suppose if I got a drug, I procured griseofulvin, and I want to prepare a cream. So what do? I firstly reduce the size of griseofulvin. Am I going to use such a big particle? No. So size reduction. Then I'm going to separate. I'm going to make the uniform size particles. Size separation, filtration, drying, centrifugation, mixing. These are few of the unit operations that are involved while you are processing your drug in the industry at a pilot scale or at a scale up batch level. So that is why this is very important. Other monophasic dosage form like syrups, elixir, link test, ear drops, eye drops, nasal drops. You need to know just the basics, that what are the excipients added. Next up, we have medicinal chemistry part 2, where we have CNS drugs and ANS drugs. So anti-epileptic drugs, analgesics, anxiolytic, which is anti-anxiety, serotonergic drugs. You have drugs acting on sympathomimetic system, parasympathomimetic system. So you need to know them. Then CAD, computer-aided drug designing. This is very important, and you cannot leave CAD. Next up we have is anti-hyperlipidemic. So these are drugs that are used to reduce the cholesterol level. So statins, fibrates, these are few of the drugs from this category. Local anesthetics and general anesthetic is another broad concept from which questions can appear. And lastly, we have anti-ulcer. So anti-ulcer may we give proton pump inhibitors, antihistaminics and all. So you have to know, you need to know the classification of these drugs. Next we have is natural products and solid dosage form. So in this we need to remember tablet capsules very well. You cannot leave anything from tablet capsules. This year there were two questions on tablet and capsules. So you need to know the appropriately their everything right from excipients up to the manufacturing and formulation. These are the books that are recommended, Martin, Lackman, Remington. So you can refer these books as well. From these books the questions are being asked very frequently. Speaking about cognosy, so cognosy you have primary metabolites and secondary metabolites. So you can expect few questions from tannins, steroids, alkaloids, glycosides, flavonoids, volatile oils. There have to be question on such topics. Speaking about extraction, so from extraction we can expect oxalation, we can expect maceration, percolation, digestion. So this is what is needed from this particular topic. And next topic is vitamins. So vitamins may you need to know the deficiency of which vitamin can cause which disease, what are the rings present in the vitamins, and what are the synonyms of that vitamin. If I speak about D, so I should know that cholecalciferol is an active form of vitamin D, and deficiency of vitamin D can cause rickets and osteomalacia or tender bones. So that is what is important and is expected to be remembered. Hormones, so you need to know the hormonal which hormones in which disease their levels is elevated or their levels is diminished. Bioactive products, so here you have peptide hormones. So here you have insulin, which is a naturally occurring peptide hormone. So that is to be remembered. What are the number of amino acids and how is it acting, the mechanism of action, and its corresponding analogs. So this is what is important. Next up we have eicosanoids. Eicosanoids are basically your autocoids that are prostaglandins, thromboxanes, leukotrienes, interleukins. These are all inflammatory mediators. So suppose if you are running somewhere and you fall all of a sudden, or if you are standing and an ant bites you, what does happen? That area becomes red. Why so? Because it is inflamed. The mediators have arrived and they are now showing, continuing the process of inflammation. So there are mediators and there are drugs that act on these mediators. Next up we have is the drug discovery process and the drug designing. So drug designing may we have two types of drug designing: structural based drug designing and ligand based drug designing. So you need to know the both the types of drug designing very well. It is expected that you remember. Then you need to know the process of clinical trials, all the phases of clinical trials. This year also there was a question on clinical trials, and the process of drug designing. So you have lead optimization and hit identification. What is that? Suppose if I want to synthesize a new drug, so the drug will be the lead molecule. That is, that drug is called as a lead molecule. And what is hit? Hit is, suppose that drug is acting on XYZ receptor. That drug is meant for reducing the anxiety. So that XYZ receptor will be my hit. Hit identification and lead optimization. This is the process. So you need to know the steps appropriately. And combinatorial chemistry. So we have two types of combinatorial chemistry: solid phase synthesis and solution phase synthesis. So you need to know the steps like cleavage, deprotection, protection, coupling. All the process is to be remembered. Next up we have is pharmaceutical technology catalytic process. So this is usually not expected because we do not study them. So I would suggest that you all can leave this topic in option, and if time persists you all can definitely move back and adopt to this and learn back upon these topics. Finally, steroids. So steroids, may we have corticosteroids, we have mineral corticoids, we have so many steroids that are acting on progesterone, testosterone, estrogen, sex hormones, sex steroids. We have anabolic steroids which are consumed by bodybuilders. Then we have so many oral contraceptives. So types of oral contraceptives we need to remember. So that is expected from this part. Next up, we have drug delivery system. So we need to know pre-formulation studies because questions are asked from pre-formulation for sure. So if you leave this part, it's a big mess. Next up, we have NDDS, which is novel drug delivery system. So usually when we consume a syrup or a tablet, it takes us some amount of time, a certain amount of time for it to be show its mechanism. But there are certain ways in which you can enhance the onset of action, or you can even delay. Like suppose if somebody is suffering from epilepsy, so there might be frequent seizures, there might be frequent tremors. So to avoid that, we need a system that is controlled release, that is sustained release. So for that, we need to design a sustained release formulation. Finally, biotechnology. In biotechnology, we have ELISA, which is enzyme linked immunosorbent assay for AIDS. It is a diagnostic test. Then we have PCR, then we have southern blotting, western blotting. Then we have fermentation. They focus more upon fermentation, so do not leave the fermentation ka topic. It's very important. It is also called as bioreactors. The fermenters are also known as bioreactors. Finally, we have validation and regulatory requirements. So here we need to study about quality control, quality assurance, DPCO, which is a drug price control order, INDA, NDA applications, the form numbers, and some part of jurisprudence. So you cannot leave jurisprudence. Jurisprudence this year there were 5 questions. So imagine out of 50 questions, you have 5 questions appearing from this particular topic. So lastly, I would just like to revise the quickly that what all things are important. So all of the things that I mentioned, like pharmaceutics, ecology, cognosy, jurisprudence, are very important. And you have 50 questions for 50 marks. Each right answer will carry 1 positive mark, and each wrong question, there are no negative marking. So you have to, and you can attempt all questions, there are no negative markings. So that is one advantage, and you can also go back to the previous question. It is not a single visit system. So once, suppose if you are question number 5 and you realize that you have marked the wrong answer for question number 1, so you can quickly move to that. But in Manipal exam, it's not the same. Once you have visited that question, you cannot revisit that. So that's all for today's video. I hope you all did enjoy and did learn a lot from my video. If there are any comments, queries, doubts or suggestions, you feel free to contact me on through my mail account, or you can feel free to drop your comments in the comment section. Thank you so much, everybody.